Welcome to HeInfo channel. So, you're telling me this tiny sticker can help with menopause symptoms? What is this, medical magic? Well, not quite magic, but science. Today, we're talking about the estradiol patch, a popular hormone therapy that helps with menopause symptoms, osteoporosis prevention, and more. What is the estradiol patch? The estradiol patch is a transdermal estrogen therapy, meaning it delivers estrogen through the skin into your bloodstream. Unlike pills, which go through your liver, patches provide a steady dose of estrogen with fewer side effects. Who needs it? Doctors may prescribe the estradiol patch for menopausal symptoms, hot flashes, night sweats, mood swings. Osteoporosis prevention, to strengthen bones after menopause. Hypoestrogenism, low estrogen levels due to surgery or medical conditions. Gender-affirming therapy, for transgender women and non-binary individuals. How does the estradiol patch work? Estradiol acts on the estrogen receptors to relieve vasomotor systems, such as hot flashes, and urogenital symptoms, such as vaginal dryness and dyspareunia. Estradiol has also been shown to exert favorable effects on bone density by inhibiting bone resorption. Estrogen appears to inhibit bone resorption and may have beneficial effects on the plasma lipid profile. How should this medicine be used? Transdermal estradiol comes as a patch to apply to the skin. Transdermal estradiol is usually applied once or twice a week, depending on the brand of patch that is used. Some women wear a patch all the time, and other women wear a patch according to a rotating schedule that alternates 3 weeks when the patch is worn followed by 1 week when the patch is not worn. Always apply your transdermal patch on the same days of the week every week. There may be a calendar on the inner flap of your medication carton where you can keep track of your patch change schedule. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Use transdermal estradiol exactly as directed. Do not apply more or fewer patches, or apply the patches more often than prescribed by your doctor. Your doctor will probably start you on a low dose of transdermal estradiol and may increase your dose if your symptoms are still bothersome. If you are already taking or using an estrogen medication, your doctor will tell you how to switch from the estrogen medication you are taking or using to transdermal estradiol. Be sure you understand these instructions. Talk to your doctor about how well transdermal estradiol works for you. You should apply estradiol patches to clean, dry, cool skin in the lower stomach area, below your waistline. Some brands of patches may also be applied to the upper buttocks. What side effects may I notice from receiving this medication? Side effects that you should report to your care team as soon as possible. Allergic reactions, skin rash, itching, hives, swelling of the face, lips, tongue, or throat. Blood clot, pain, swelling, or warmth in the leg, shortness of breath, chest pain. Breast tissue changes, new lumps, redness, pain, or discharge from the nipple. Gallbladder problems, severe stomach pain, nausea, vomiting, fever. Increase in blood pressure. Liver injury, right upper belly pain, loss of appetite, nausea, light-colored stool, dark yellow or brown urine, yellowing skin or eyes, unusual weakness or fatigue. Stroke, sudden numbness or weakness of the face, arm, or leg, trouble speaking, confusion, trouble walking, loss of balance or coordination, dizziness, severe headache, change in vision. Unusual vaginal discharge, itching, or odor. Vaginal bleeding after menopause, pelvic pain. Benefits and risks. White heavy checkmark pros. Steady hormone levels. Lower risk of blood clots than oral estrogen. May improve skin and hair health. Warning cons. Can cause weight gain. Raises your risk of certain cancers, blood clots, and strokes. If you have your uterus, you have to use the estradiol patch with another hormone, called progestin, to lower your risk of uterine cancer. Not safe if you have liver problems. Q&A. Can I swim or take a bath while wearing the estradiol patch? It depends. You shouldn't swim, take a bath, or use a sauna if you use the once-weekly version of the estradiol patch, as this could affect how your body absorbs the medication. These activities are safe to do if you use the twice-weekly patches. Can I wear more than one estradiol patch at a time? No. Wearing more than one estradiol patch at once raises your risk of side effects. If you feel like this medication isn't helping your symptoms enough, speak with your provider to see if you need a different strength patch. Does the estradiol patch cause weight gain? It can. Certain brands of this medication can cause weight in up to 9% of all people who use it. If you have been gaining weight since you started the estradiol patch and it concerns you, please speak with your provider about alternatives. Are estrogen patches used in gender-affirming hormone therapy? Yes, estrogen patches like estradiol patch are sometimes a preferred option used off-label in estrogen-based gender-affirming hormone therapy, GAHT, if you are an active smoker or if you are experiencing migraine or mood swings from estrogen injections. So, if you're dealing with menopause symptoms or need estrogen therapy, the estradiol patch might be your tiny but powerful solution. Have you tried the estradiol patch? Let me know in the comments. And don't forget to like, subscribe, and hit that bell so you don't miss more health tips.